There's a bone at the base of your spine that your doctor almost never examines, and it may be the single reason your lower back has been failing you. Not your discs, not your muscles, not your posture. This one triangular bone, sitting at the very foundation of your skeleton, can lock into a single position and radiate dysfunction upward through your entire spine for years. And there's a 90-second technique documented in osteopathic medicine and quietly practiced in Ayurvedic bodywork for over 2,000 years that may reset it tonight. Your lower back isn't weak, it's braced. There's a difference. When we say lower back pain, we picture torn muscles or slipped discs, but for millions of people, the real issue is a sacrum that has lost its natural rhythm, its ability to rock, glide, and decompress with every breath you take. That mobility is supposed to be there. It was built in, but modern life eliminated the movements that keep it alive. For most of human history, we squatted to eat, sat cross-legged on the earth, walked uneven terrain, and changed positions dozens of times an hour. The sacrum was constantly moving, constantly pumping cerebrospinal fluid through its rhythm, constantly resetting itself. But chairs changed everything. Flat, rigid, right-angled chairs compress the sacrum into a fixed posterior tilt. We sit for 8, 10, 12 hours a day. It stiffens. Circulation slows. The surrounding ligaments shorten and bind. And then we stand up and wonder why our lower backs scream. Ancient Ayurvedic physicians called this region the khanda, the root knot, and described it as the convergence point of 72,000 nadis, or energy channels. They weren't being poetic. They were describing, in the language of their time, what modern neuroanatomy confirms: the sacral plexus, a dense web of nerves originating at S1 through S4 that governs sensation and motor function. And in your legs, your pelvic floor, and your lower lumbar spine. Same structure, different language. Here's what happens inside your body when the sacrum locks. The sacroiliac joints, the two interlocking surfaces where the sacrum meets the pelvis, are among the most load-bearing joints in the human frame. They're held together by some of the thickest ligaments in the body. When the sacrum stops its natural nutation, that subtle forward-rocking motion that should happen with every inhale, those ligaments tighten asymmetrically. One side pulls harder than the other. The pelvis torques. The lumbar spine compensates. The muscles of the lower back, the quadratus lumborum, and the erector spinae fire continuously just to hold you upright because the joint beneath them has stopped doing its job. That compensation is what you feel as lower back pain, not damage, exhaustion. Modern research confirms this mechanism matters. A 2017 study out of the University of Pittsburgh's Department of Physical Therapy found that sacroiliac joint dysfunction was present in up to 30% of patients diagnosed with nonspecific lower back pain, meaning nearly 1 in 3 people told their pain was mysterious, actually had a measurable, addressable joint problem at the sacrum. A separate research group at the Vrije Universiteit Amsterdam documented that sacral counternutation, the bone's ability to rock backward during exhalation, is directly tied to lumbar flexibility, and that reduced sacral mobility consistently preceded lower back muscle guarding. Your muscles aren't tightening because they're injured. They're tightening because the sacrum beneath them stopped moving. You can feel this right now if you place both hands on your low back, thumbs pointing inward toward your spine. Take a slow breath in. A healthy sacrum should allow a subtle widening sensation, a gentle, almost imperceptible bloom between your palms. If you feel nothing, or if it feels like breathing into a concrete wall, you've just located the problem. Ancient Indian physicians called that sensation prana moving through the khanda. Sports physiotherapists call it sacral nutation. Your body just calls it breathing freely again. This technique is called sacral decompression, and it takes 90 seconds. Find a firm surface, a yoga mat on the floor, not a bed. Lie on your back with your knees bent, feet flat, hip width apart. Let your arms rest at your sides, palms open toward the ceiling. Before you begin, take 3 slow nasal breaths just to arrive. This works best first thing in the morning before your body has loaded the joint, or last thing at night. Beginner version. Gently rock both knees together to one side until they reach about halfway toward the floor. Not all the way down, halfway. Hold for 4 slow breaths. Feel the sacrum rotate and one side of your low back soften toward the ground. Return to center. Repeat to the other side. That's 1 round. Do 3 rounds, alternating sides. Key focus. Keep your lower back heavy, not braced. The moment you tense, you lock the joint again. Common mistake. Going too far, too fast. This isn't a stretch. You're giving the joint permission to glide. Intermediate version. After 3 alternating rounds, draw 1 knee toward your chest while extending the other leg long along the floor. Hold the bent knee with both hands and take 5 deep diaphragmatic breaths. You should feel the sacrum on the extended leg side release its grip and drop closer to the floor. Switch sides. This creates a gentle traction through the sacroiliac joint on each side independently. Advanced version. From the intermediate position, add a slow internal rotation of the extended foot, toes rolling inward, while you hold the knee to chest position. This engages the piriformis and deep external rotators simultaneously, unlocking the sacrum from below. When you can hold this for 10 full breaths per side without your lower back lifting off the floor, you've restored functional sacral mobility. Beginners, practice this daily for the first 2 weeks. For maintenance, 3 to 4 sessions per week is enough. Mastery path, integrated as a daily morning ritual before you load the spine for the day. First session, you'll likely notice one side releases more easily than the other. That asymmetry is information. It tells you which sacroiliac joint has been carrying more load. After 3 days, many people notice morning stiffness arriving later and leaving faster. After 7 days, you may find you can stand from a chair without that familiar stiffening grab in the low back. After 30 days, the pattern often begins to self-correct. The sacrum starts finding its rhythm again, even without the conscious reset. One important note: if you have a confirmed sacral fracture, recent spinal surgery, or severe osteoporosis, check with your physician before practicing this. If you feel sharp radiating pain down your leg during the movement, stop and consult a professional. This isn't a stretch. This is a conversation with the most load-bearing crossroads in your entire skeleton. Modern physical therapy tells you to strengthen your core, and that's not wrong, but it's incomplete. Ancient Ayurvedic physicians knew that a locked khanda, a frozen root, meant no amount of strength work above it would hold. You cannot build a stable structure on a seized foundation. Your sacrum isn't broken, it's forgotten. Forgotten the rhythm it had when you sat on the earth, when you walked barefoot on uneven ground, when you moved the way your skeleton was designed to move. For thousands of years, humans didn't need sacral decompression exercises because daily life provided the movement automatically. We lost the movement, and we inherited the pain. You just practiced what traditional Ayurvedic bodyworkers considered foundational preparation before any other physical practice, not as flexibility training, as restoration of the root. Looser hamstrings and a pain-free morning aren't the goal. They're the side effects. The goal is giving your nervous system a foundation that isn't braced against itself. Tonight, try the beginner version before bed. Tomorrow morning, notice how quickly you feel like yourself when you stand up. In 7 days, notice what's no longer there. And if this reached you at exactly the right moment, you know what to do. As always, keep moving. Talk soon.